Hi, I'm Jodie and I'm here at the QUT Clinical Practice Facility, and I'm going to show you how to set up and put together a patient-controlled analgesia. This is something that you will be able to do out on clinical practice and be confident and competent in doing that skill. So the equipment that you will need to draw up a PCA is your PCA orders, which is for morphine, 50 milligrams in 50 mils. So you will need 2 RNs to grab out with your DD cupboard and key your morphine, and we have 100 milligrams in 2 mils and the expiry date is in date. I have a 3 mil syringe to draw that up, along with a drawing up needle, our extension tubing to attach the 50 ml syringe that will go into our patient, 2 alco wipes. We need 5 ampules of normal saline, and then also our label to label the syringe. Okay, so I've prepared all my equipment and I've drawn up my 10 ml normal saline flush. First I'm going to draw up my morphine, and I needed 50 milligrams in 50 mils. So out of my ampule of 100 milligrams per 2 mils, I need 1 mil of that. So I'll actually draw up all of that to ensure that that's correct, and just get rid of that air bubble. And normally I would put that into the sharps, but just to save movement, I'll pop that back into the ampule. And there is my 1 mil. That then goes into my 50 ml syringe, and I'll dispose of that. Now another drawing up needle to draw up my fluid, which is normal saline and has all been double checked. So ensure as you go through that you're getting rid of a lot of that air and any air bubbles at the end as well. And don't push your plunger whilst you have your needle in the ampule, otherwise you'll push all your fluid out of the ampule and lose some of it. So on the last one, this is where I'm going to get rid of all of those air bubbles to make sure that I get my dose correct. And once I've got that there, I've got just over 40, because there's always a little bit more in your ampules. And now I'm just going to very carefully draw that back. I do have an air bubble in there, so I'm just going to get rid of that and check to make sure whether that's exactly 50, which it is, which is good. Take off my drawing up needle, and now put on my tubing. And very slowly just push that through. And I'll just clamp that off and take with me all those ampules to the bedside with my alco wipes. And again, just like last week with our insulin, filling in patient name, ID, date of birth, medication, which would be morphine, 50 milligrams divided by 50 mils, which is 1 milligram per mil, diluted as normal saline, date, time, and our signatures. And then all of this will come with me to the bedside. Now that it's all drawn up and we've gone to the patient bedside, so myself and my partner as another RN. We've got our patient orders, and we need to double check his name and date of birth and allergies, along with his UR number. So one of us will will ask the patient, and one of us will read out the UR number and check that on the chart. So with the machine, we've got our PCA machine, that's a locked machine, and I'll turn it to the first point, just to turn that on and get that warmed up and starting. It's asking me if it's a new patient, and I'm going to check, hit yes, and then yes again to confirm that it is a new patient. Just before I do anything else, just in case that needs to go through a warm-up process, I'm going to check the site looking at the dressing and also the skin under the dressing as to whether there's any redness, swelling. The dressing is intact, so that would need a little bit more tape or a new dressing, and any oozing from the site as well. I'll quickly flush the line just to make sure that it's running. And to do that, first up we just need to swab our port, take off my sharp, as this one goes straight in. Make sure the line is open, and I'm just going to flush that with a quick 5 mils. I don't need the full 10, just to make sure that it's running nicely. And that's all okay. I don't need to turn the tap off because I just disconnect from the site. While that's up and clean, I'm just going to quickly put on my tubing so that I don't have to clean that again. And that's connected. So with our syringe, we also need to put on our label, remembering different ways will need to be done depending on the machine, but always making sure that you can see the numbers and the lines. Don't need to see all the line, and the patient's name. So now that our label is on, we pop this into the machine. So make sure that the line is going out through the gap so it doesn't get caught. This piece here just sits in, and make sure that that's in the groove, and we close that off and we close the door, and that's now locked. Our machine is asking if we have a new patient, so I'll just confirm through with that. Now this comes up automatically in the morphine protocol. However, we're going to need to modify what is on the screen. To do that, choose Modify Protocol. Drug name, we don't need to change, so I'll go down to the next one. The drug concentration is 1 milligram per mil, which is correct as we've got 50 milligrams in 50 mils. The next one is the PCA dose, and you find that on the paperwork, and our PCA bolus is 2 milligrams, so I need to alter that by choosing the Alter button and using the Up button to go to 2 milligrams. That means that every time they press the PCA button, they'll get a dose of 2 milligrams of morphine. The next one is the lockout period, which on our orders is 10 minutes. This is at 5, so again I need to alter that and increase that to 10 minutes. And confirm. The next is the occlusion level, which on the older machines you may or may not need to set and is not included on the newer one, so I'm going to leave that at 5 for today. The next is the continuous, so this is the underlying amount of morphine that your patient will get, and on our orders it says 0 to 2 milligrams per hour. If this is new and they're in quite a bit of pain, you can choose to start at the larger dose. Now it comes up in micrograms, I'm not quite sure why, but that will change to milligrams very quickly for you. And I'll take it up to the 2. Our loading dose, there is no loading dose on our orders, so we leave that as 0. The maximum limit has got 10 milligrams in 4 hours. I'm going to leave that maximum limit as part of the protocol, and the PCA delivery as stat, which is what we would like, because when they press the button, we want them to get that medication straight away. I'm going to choose OK, and now it's time to then check all of that protocol through and check the orders with my partner who's helping me with this, and if it all matches, we can go through to the next step, which is turning the key to the green. It will then ask us to confirm that again, and again we read through this and the orders together and hit OK to confirm. and the machine will go through. It asks us to confirm the syringe type. We have a Terumo 50, so that is correct. And then all we need to do is hit start. And that will go straight into our patient and they can use the button if they wish. Put your PCA up and it's running for the patient. It's really important that you do continual observations as required by your PCA chart, and also that you do regular pain assessment and ensure that they're using the PCA correctly. So that may be ongoing education with not just the patient but also their family, and ensuring that they understand how to use it properly throughout the day or the shift. It's also important for yourselves to look at how you went with the procedure. Was there steps that you missed, information that you weren't quite sure of, questions that you had at the time, to reflect back on how you went and how you can improve in the future.